Hi, I'm Gloria Leno, and I appreciate the opportunity to give my presentation to you on YouTube. From the 21st volume of the 1995 Journal of Marriage and Family Therapy, the article that I selected is titled "The Effectiveness of Family Interventions in the Treatment of Physical Illness." It was co-authored by Dr. Thomas L. Campbell and Joan M. Patterson, PhD. Joan Patterson is an associate professor of marital and child health in the School of Public Health at the University of Minnesota in Minneapolis. Thomas Campbell is a medical doctor and associate professor of family medicine and psychiatry at the Primary Care Institute of Highland Hospital and the University of Rochester Medical School in New York. Physical illness and its relationship to the family have been to a great extent ignored by family therapists and researchers until just recently. However, before coming to the arena of social science, I was a nurse and biologist. My interest naturally lends towards integrating the knowledge from my previous profession with marriage and family therapy. So that being said, and the fact that this gave me useful information for writing my dissertation, this selection was a good one for me. This particular article is simply a review of the existing literature as it pertains to the effectiveness of family interventions in the treatment of physical illness. Campbell and Patterson write that their paper is a review of the literature on family interventions in child and adult physical illness and in health promotion and disease prevention. Out of the articles that we had to choose from, I was drawn to this particular one because my dissertation is centered around the meanings that family members place on illnesses and the normal systemic family process of recovery. Because my dissertation is focused on how families of the Cajun culture deal with these issues, reading and reviewing Campbell and Patterson's writing offered some insight into my general area of interest. There exists a body of research that indicates that family members have a strong influence on the physical health of other members of the family. Our authors tell us that after reviewing the existing work, they find evidence which shows that family interventions used in cases of physical illness is effective in chronic childhood illnesses such as asthma and diabetes. They uncovered further evidence that cardiovascular, neurologic disorders, and the treatment of obesity are three other areas that show that family interventions and therapy may produce a better outcome for the patient than strictly medical treatment alone. In their review of the literature, they posit that the role of medical family therapy is increasing in its importance in the new healthcare system. Culturally, we're so accustomed to a division between mind, body, biology, and psychology, and it's relatively easy because of this division for us to ignore the co-kinship between physical illness and its relationship to family. Our authors call to our attention the fact that as far back as the late 60s and early 70s, pioneers in our field such as Bowen, Minuchin, Weakland, Wine, Cromwell, and several others did in fact pay attention to explore and give credence to the unique dynamic brought about inside the family unit when one of its members is physically ill. Now, in recent years, it's been noted that there is a great deal of interest in the role that a family therapist plays when working inside of a medical setting, taking care of physically ill patients and their families. To some extent, this interface between family therapy and medical treatment has not been well studied. Psychosocial treatments of individuals and families who are dealing with medical problems is a relatively new spot on the horizon. To help promote a more family-centered and collaborative model of healthcare delivery, we are seeing family therapists, family nurses, family physicians, and other healthcare professionals coming together to form collaborative family healthcare coalitions. Inside of our healthcare system, we're in the throes of giant changes at this time. We have not experienced anything like this in our healthcare system since the turn of the century. We find that healthcare services are being reorganized into managed care systems that are vertically integrated in a way that demands providers show that they are offering services that are cost effective. Personally, I have a problem with this. We have reached a point that it's no longer of paramount importance to provide good, thorough, effective mental and physical health care. But in addition, now we have to take into consideration whether or not the services that we provide are cost effective. However, this is a tangential issue to this particular article. In this particular literary review, our authors recognize that family health therapists will be challenged by the new healthcare system. But they also call to our attention the fact that this system will also bring with it new opportunities to show that collaborative health care, which integrates traditional medicine, traditional medical care, and psychological, psychosocial services, can produce not only very effective family therapy, but also cost-effective services. Spotlighting the fact shows that this is a very important time to review the evidence that family interventions can lead to better health care outcome in the treatment of physical illness. Information comes to light that during the last 20 years, we have during the last 20 years seen published research that scrutinizes the relationship between family factors and health. And many studies better recognize the importance of family in all aspects of health care, be it physical or mental. This family health research demonstrates that time after time, the family has a compelling force on an individual's physical health. Even though we have gained greater understanding of the relationship between family factors and health, it's important that we keep in mind that research on family interventions in healthcare is relatively new. Randomized, controlled trials of family therapy in healthcare are few and far between. Most of the work cited in this particular article was from uncontrolled trials of family interventions, case studies, and anecdotal evidence. Campbell and Pattison write that in part the reason for this lack of research is that we are just beginning to understand what family variables are important in physical health and how they exert their influence. The authors call to light strong evidence that social support, particularly from family, profoundly influences overall morbidity and mortality, and the course of most chronic illnesses are also influenced by family participation. As I mentioned earlier, I was drawn to this exact article because it analyzes information that runs in parallel to the information that I plan to explore through an autoethnographic approach in my dissertation. Since this article was strictly a review of the existing body of knowledge, there's no specific methodology, research techniques, or data collection or findings to report. In Campbell and Pattison's comprehensive review of the existing body of research, They conclude that there is evidence to show that family has a high impact on health across different age groups and illnesses. Probably because family intervention studies are still in their infancy, Campbell and Pattison posit that even though they are not conclusive, family intervention studies, to say the least, are promising. They write that their research did demonstrate that family interventions are more effective than individual approaches for some chronic childhood diseases, especially asthma and diabetes, and that with no great uncertainty whatsoever, family therapy improves the medical outcome in dysfunctional families who have an asthmatic child. Campbell and Pattison conclude that enhancing family support for hypertension compliance appears to have a powerful effect on health outcomes. They conclude also that family interventions for caregivers of demented and stroke patients clearly reduce caregiver burnout and depression, and certainly aid in delaying the institutionalization of these demented patients. Although this research provides some evidence that family intervention, particularly family psychoeducation, results in better outcome in the prevention and treatment of physical illness, much more research is recommended. Additionally, it is recommended that family therapists need to become more involved in the design and implementation of research trials. Campbell and Pattison state that their review of the research implies that family therapists have an important role to play in the management of physical health problems, and that we need to see ourselves as healthcare providers and recognize the fact that we are an essential member of the healthcare team. It is implied that family therapy training programs should provide training for family therapists to aid them in becoming proficient at working inside of a rapidly changing healthcare system. Campbell and Pattison surmised that the current crisis and rapid change in the healthcare system represents not just a challenge to the field of family therapy, but also an opportunity for family therapists. They claim practicing business as usual is becoming more and more difficult as healthcare becomes capitated under managed care. But they reiterate that the new system will encourage innovative, cost-effective approaches that provide integrated medical and physical health care for families. They declare that the current research demonstrates that there are effective family innovations for some physical disorders and suggest promising family interventions for many others. This was approximately a 35-page article and not necessarily an easy read. However, before coming to the social science arena, as I mentioned before, I was a nurse and a biologist. My interests naturally leaned towards integrating the knowledge from my previous professions with marriage and family therapy. So that being said, and the fact that this gave me useful information for writing my dissertation, I think that it was time well spent for me. Thank you very much for taking your valuable time to view my presentation. I am sorry that it was impossible for me to join you in collaboration, so please accept my apology and know that I am with you in spirit.